Good afternoon, all. Am I audible?
Yes, Hannah.
So, today we are going to talk about Ostomy Care, and our faculty is with us. Anna ma'am, warm welcome for you, and dear participants, I would welcome you all for the session. And I'm handing over to Anisha ma'am to introduce our faculty. Ma'am, over to you.
Good afternoon, everyone. This is Anusha. Today I'm your facilitator. Today our speaker, Miss Anna ma'am. She holds multiple nursing qualifications, including GNM, PBBSc, nursing and CCPN and NFPN, FPC, with a strong foundation in both general and palliative care nursing care. So currently, she's working as a trained palliative care nurse in hospital settings. She is actively involved in both inpatient care and home care visits. And also, she has completed the NFPN from IPM, and she brings nearly 10 years of experience in cardiac care, having served as the nursing in charge in cardiac unit, showcasing her leadership and clinical expertise, and 20 years of experience in training and mentoring nursing students. She plays a key role in shaping the next generation of compassionate and skilled nurses. Welcome, ma'am. Welcome for this session.
Thank you, ma'am.
Dear participants, if you have any doubts, you can put it in chat box.
Ma'am, will you be sharing PPT from your end?
Ma'am, I'll share. Just a second.
Okay. Thank you. Thank you.
Ma'am, you can start.
Yes, thank you. So, thank you very much for that introduction. So, what is ostomy? Let us start with the definition. Next slide, ma'am. So, ostomy is an artificial opening in the cavity, okay, through which the organ would be brought up on the surface. So the organ may be different, right? When we talk about the colostomy, it would be maybe colon, okay? And if we talk about mainly two types of ostomy we are going to discuss today. One is colostomy and second is tracheostomy. Okay? These two we find very common in palliative care settings. So we will discuss about both today. So what are the types? Okay, there are two types basically for the purpose. One is input ostomy and another is output ostomy. So some examples are given here for input ostomy like tracheostomy, gastrostomy, feeding ileostomy, okay? And another one is output ostomy. So for that also we have some examples here like colostomy, urostomy, ileostomy. Okay, so it will depend on the disease of the patient. Okay, what is the stage of the disease? Okay, because it will depend whether it will be closed or the later stages or not, or the patient has to stay and live with it throughout his remaining life. Okay, now let us see certain phases. Okay, what are these phases that come into life of a person who is chronically ill? Okay, most of our patients are chronically ill, those who are having ostomy, right? So next slide, ma'am. These are the phases. Now these phases are actually true for any interventional procedure. Okay, say if the patient is having cancer, okay? So the first phase may be to accept whether the patient is having the disease. Okay, he may be in condition of he may go into shock, or he may become panic. Okay? Once you pronounce the uh, diagnosis for any such life-limiting illness to the patient and relatives, both will have this first phase, right? Second is they may say that no, this cannot happen to me. I have done so many good work, so they would like to defend themselves, may retreat also, and they will totally deny. Okay, and then this starts the doctor shopping, right? They will take another opinion from another doctor. They will go to further investigations and all sorts of things. Okay, then comes acknowledgement. They may acknowledge that okay, this may have occurred, okay, and I have to live with it, and slowly they move into adaptation phase. Okay, so whether the patient and relatives adapt to the condition, it will depend on so many factors. Okay, and we as nurses, we have to help them to adapt to the situation, because sooner they adapt to the situation, to their diagnosis, better, right? So that they can learn, because there are many problems that will come ahead, and they have to learn many things. They totally have to reset their life ahead, right? Some of the very common uh, doings which we take for granted, say for example eating, okay, passing stool, now these common functions will have difficulties, okay, and they have to adapt to the procedures. Okay, so it is very very important that the patients and relatives adapt to the what comes next. Okay, so that is very important. Next slide, ma'am. So let us move to colostomy first. Right. So what is the definition here? You might have learned it, okay, and you might have seen many of the such cases also. Right. We all are here. We will go through the slides and discuss also side by side, and we are here to learn from each other. Right. Okay. So take interest and uh, answer questions when they are asked. Right. So colostomy is a surgically created artificial opening, okay, into the colon through the abdominal wall. Okay, so here we want to remove the fecal matter through the opening, which will be now on the abdomen. Okay, so the person has to adapt. You can imagine, right? So I was watching one video. So in that, a patient who had taken it very, I mean, he had adapted to the situation, and he was, I mean, telling that okay, now my rectum is on my abdomen. Okay, so when it will come, when the person can say so easily, right? So it is very important that the patient learns, adapts to the situation. There may be many indications why the patient has to undergo colostomy. Okay? Some are given here. There may be many more. Right? So one is ulcerative colitis, Crohn's disease. Mostly we see cancer colon. Right? It is quite common. Even obstruction is also very common. Sometimes a small baby can also have colostomy. Imagine the condition of the baby and the psychological and all sorts of trauma that relatives, the parents are going through, right? In case of congenital abnormalities. It can be because of injury, trauma also, and in some cases fistula, right? Like RVF. Okay, so there may be many other indications. Next, ma'am. So let us move to the types. Okay, so depending on the time period, okay, how long the colostomy will be there. Okay, based on that, there are two types. One is temporary. Okay, so here what happens? It is done normally for diversion of the fecal material. Okay, so that you give rest to the colon, okay, for and allow the stitches to get healed. Okay. And later this will be there may be any second phase surgery, okay, or it may be uh, closed at the later stages once the healing has taken place. Okay. So that is temporary colostomy. Another one is permanent colostomy. Okay, now the patient, his condition is deteriorated so much that for rest of his life he has to live with colostomy. Okay, so many times this procedure is done in conjunction with removal of lower bowel and rectum. Say there is large size of tumor is there, okay, or metastasis has taken place. Okay, such cases it will be permanent in nature. Next, ma'am. Next, one more. Next. Now, depending on the type uh, of the incision. Okay, so first is loop colostomy. Okay, so in this it is a kind of loop that is created. You can see, ma'am, previous slide. Yes, thank you. So loop colostomy is made usually in case of emergencies, and it is kind of temporary, and there will be large stoma. Okay, because you can see in the figure also it is quite large, right? Okay. Now the loop of bowel is pulled out in this case onto the abdomen and held in place with external device. Okay, so here one part is for the release of the stool, okay, and another one is for removing of the mucus. Okay, so a loop of bowel is pulled out on the abdomen and held in place with external device. The bowel is then sutured to the abdomen and two openings are created in one stoma. Okay, so it will be quite large in nature, right? Okay, next slide, ma'am. One more. Next slide. Yes, thank you. So, end colostomy uh, is stoma. Here only one opening will be there. You can see in the figure, okay, on the right side. And stoma is created from one end of the bowel, and the other portion of the bowel is either removed or it is sewn shut. Okay, for example, Hartmann's procedure. Another one is double barrel colostomy. Here the bowel is severed, okay, and both the ends are brought out onto the abdominal wall. But only proximal stoma is functioning. Okay, so in double barrel also there are two separate openings. Okay, you can see in the figure. Okay, one is for removal of the stool and another one is for the mucus removal. Okay, the type of procedure will depend on the nature of the disease. Okay, what kind of result is desired? Okay, whether temporary or permanent, and of course for the physician's preference. Next slide, ma'am. So, what are the goals of treatment? So basically, we want to give rest to the bowel because so large part of the bowel is removed and lot many sutures would be taken. Okay, so if the bowel is functioning throughout, then healing will be very difficult. Okay, it will get inflamed, it will get infected. Okay, and it will be a very long time. Also we want to, so we are giving rest. Okay, so for that period we control the inflammation also. Okay, we prevent any kind of infection and because the gut will have lot many bacteria. Okay, some may be useful, some may be not useful, causing disease. Okay, so we want to combat infection also. Okay, then we also want to correct any kind of malnutrition. Okay, then we need to give nutrition, and parenteral nutrition is also given. Then reduce stress. Okay, that is also one major goal. Then provide symptomatic relief from the condition. Okay, whatever the symptoms, they may be very stressful. Okay, so we want to give symptomatic relief. And of course, our in palliative care, we want to improve the life of quality of the patient. Next one. So when we are assessing needs, right, you must have learned 4 domains of total pain. Right? So here we want to assess not only the patient but also the relatives. Right? So all 4 angles should be assessed properly. What are the different problems that occur in these domains? Okay, what happens to his daily care, whether he is able to do or not, whether any nutritional requirements are met or not. We need to communicate with healthcare professional, whether patient is isolated, relatives are isolated or not, and whether they require any assistance for any other issues. Next, ma'am. Yes. So first comes the list of physical problems. Okay. So identify where is it located, size of the wound, size of the stoma, because some stoma may be large in size. Okay. There may be different problems with the stoma. Okay. It may be herniated. Okay. It may have prolapse. Right. Many problems occur. So we want to find out if any kind of exudate is there. Okay? Find out what is the level of it, what is the type, whether it is giving away foul odor or not. Okay, then there may be secondary infection also. Okay, so identify it. Then identify what is the pain level. Do thorough assessment. All you know how to do pain assessment, right? So depending on that, you have to identify what is the level. Okay, including we have to see to it during dressing also. Okay, because our patients will require dressing also, even in stomach. They may have to change bags, so whether patient is having any kind of pain because of the stretching of the skin, surrounding condition of the skin, okay? Whether there is any pruritus or not, whether there is any infection or not, okay? Identify those problems. Whether the procedure is having any effects on the activities of daily life. Okay, so that also we need to assess. What is the frequency when the patient is, how many times the patient has to do dressing, because comfort during the this time will also matter a lot, and whether any infection has taken place or not. Next slide, ma'am. Right, so it will look like this. Okay, you can see the external view. Next slide. Internal view, okay, and how it will appear when the colostomy bag is applied. Next slide, ma'am. So the healthy stoma will look like this, okay, pinkish in color. One more, okay, and you can see the wafer applied surrounding it. Next slide. This is how it will look, the colostomy bag will look. Okay, so you can see how it will look from front and from the back, which will be attached to the skin, adhered to the skin, and there is stopper also here, okay, which they have to close it. Right? You can see the lower part, how it is folded and applied the stopper. Next slide, ma'am. So, immediate post-op care. What we have to observe. Okay, just like any other abdominal surgery, we have to see to it that patients' vitals are normal. Okay, so assess. So for that we will require baseline data also. Right. So then only we will be able to compare. So assess temperature, pulse, respiration, blood pressure, pain. Right. Uh, because of the pain and because the abdominal wall is incised, it may be stretching when patient is taking deep breaths. Okay, so generally these patients, and also because immediately after the anesthesia, he may be still under the effects of the drugs. Okay, so the you may find shallow breathing. Okay, but once the patient is fully out of anesthesia, okay, you see to it that patient is breathing normally. Right. Next. Furthermore, patient is instructed how to support the operative site. When we make them to take deep breaths, when we make them to cough, okay, do exercises. Okay, so at that time they have to support the incision area to the and to the bag also. If necessary, give pain medication. Okay, we also have to check for the fluid intake and output. Okay, strict intake output chart must be maintained. Check the operative site, okay, for any kind of the change in the color. Okay, whether any drainage, excessive drainage is there or not. Okay, so that we have to do assessment. Next, ma'am. Patient may be having nasogastric tube in place, and it may be attached with the low intermittent suction, or you may have to do manual suction. Okay, till the activity of bowel moves normally. Okay, fluid and electrolytes are given IV. Okay, in the case when the patient's diet is still withheld, okay, as slowly it will be resumed. In the beginning, patient may be having liquids, okay, and then he will be put on the normal diet as required, as tolerated. Patient is generally out of bed approximately within 24 hours after the surgery. Okay, and plus patient is having incision on the abdomen, so we also have to think that he should move in the bed also. Okay, next slide. So nutritional therapy, parenteral nutrition is given. Replace any kind of fluid and electrolytes. Balanced diet with sufficient protein may be given. Okay. Calorie and nutrition also should be seen that patient receives adequate amount. And if required, supplemental iron is also given. Next slide, ma'am. Assessment of the stoma is very essential. See to it when yeah, okay. So see to the color of stoma, okay, whether there is any color change, right? It normal stoma should look like uh, pink in color, okay. So if there is any necrosis or not, you may see it like black color or dark brown color, like that. Assess it for edema also, whether there is edema of the stoma itself and the peristomal area. Bleeding, sometimes it may be seen at the time of especially cleaning or changing the pouch. Okay, so at that time you may require to give slight pressure for 10 to 15 minutes. Okay, and even sucralfate powder can also be applied. Find out whether any kind of herniation is there or not. Okay, whether there is any kind of stoma prolapse is there, right? Find out that also. Generally, stoma size is 1 to 1.5 centimeter above the skin level in case of colostomy, and in case of ileostomy, it may be 3 to 3.5 centimeter above the skin level. If prolapse is less than 5 centimeter, it is normal, and it can be managed by manual reduction. Okay, but if it is more than 10 centimeter, then again surgical intervention may be required. Identify whether any kind of retraction is there or not. Okay, many times in case of retraction, patient bowel movement may be normal. Okay, then there is no need for any kind of intervention, but otherwise the intervention will be required and correction is done. Identify whether any kind of stenosis is there or not, because the stool may not come out and dilation of the stoma may be required. And of course, not to forget about the peristomal skin. Okay, so we will see how to take care of it also. Next slide, ma'am. So accurate intake and output chart should be maintained. Previous one, ma'am. Monitor the number of stools per day. How many are there? Okay. It may take around 24 to 72 hours for stoma to start functioning. Okay, initially only gas may be coming. Okay, as the patient's diet is resumed, then slowly the fecal material will appear in the bag. Okay, uh, the type of stool will depend where the stoma is made. Okay, so that we will see further. Encourage patient to talk about self-care strategies, whether he is able to adjust or not. Okay, how to cope, all those things. Explanation of the procedures, whatever you do. In the beginning, generally the dressing and all is done by the healthcare professionals, right? But slowly the patient and caretaker has to be involved in the care, because ultimately they will be doing at home. Okay, so see to it that they are able to do it independently. Stress management is also important. If he has not quit smoking, then he is instructed to do so, okay, because healing will not depend on it. What are his psychological problems? Okay, so that also we need to identify. Adequate rest also he needs to get. Next slide. So this shows what kind of stools will appear at different sites. Okay? And similar health education should be given to the patient and its relatives also. Okay? If the stoma is created in the ascending colon, then the stool will appear liquid in nature. Okay? If it is in transverse colon, it will appear mushy in nature. And if it is in descending colon, then semi-solid stools will appear in the bag. Okay, so this should be clearly stated and explained to the relatives also, so that they come to know whether there is any kind of problem or not, and whether to approach the hospital or not. Next slide, ma'am. Now first we will see how to apply the pouch. Okay. Uh, Patient can sit or stand, whatever is comfortable for the patient. He can take the position to apply new pouch, and first to remove and then apply to new pouch. Okay. Generally, the pouch is changed once it is 1/3 full. Okay. If they wait till it is full, then what will happen? Along with the fecal material, there may be gas also there may be mucus also. Okay, so because of the weight, what it will happen, the pouch will come off. Okay, so they should be told that once it is 1/3 full, it should be changed. After cleaning, when they have to apply the pouch, see to it that the skin is wrinkle free. Okay, this is very important. Otherwise, what will happen if there are wrinkles in the skin? Okay, so leaking will take place. Okay, so they have to stretch the skin and then apply the pouch, and then the adhesive should be strongly stuck to the abdominal wall. Okay, uh, for surrounding skin to avoid any kind of maceration and irritation, skin barrier creams are also applied. Okay, so they can be applied and then the pouch can be applied. Okay, so circumference of the stoma should be correctly measured. That is also very important. The opening of the bag should be uh, it should be kept little more than the size of the actual stoma. Say 1/8 of the inch, it should be larger than the stoma. Okay? So that the opening doesn't stick directly over to the stoma. If there are any obvious hair grown at the stomal site, then they can be trimmed off with scissors. But see to it that the patient doesn't harm himself. So that is why he has to use the mirror whenever he is doing any procedure on the stoma. Electric razor is also quite safe, so they can use it. Next slide, ma'am. Next slide. Next slide. Yes, so here you can see on the left side the healthy stoma. Okay, middle figure shows the two types of stoma bags. Okay, so on the left side is one piece bag. Okay, on the right side there are two-piece bag. Okay, so in one piece bag, what happens? The sticker is right on the bag itself. Okay, so when they are cutting it, they have to be careful that it is cut. There should not be any kind of zigzag in the uh, peripheral area of the bag from where it is cut. It should be good round in shape. Otherwise, the cut edges will uh, poke the skin area, which is very sensitive. In the two-piece set, what happens is that the sticker is one and another the wafer, which is called as wafer. Okay, so that will be stick, and then the colostomy bag is attached. Okay, so there are clips there. Okay, you can see in the figure. Okay, so that will set perfectly on the wafer. Okay, so there will be click sound, so then it is thought that it is fixed properly. Okay, and how it will look on the patient's abdominal wall, it is shown on the extreme right picture. Okay, so as I said, always patient should be instructed to have always mirror in the front. Okay, and they have to write date on the adhesive of the new pouch. Okay, so it will remind that when the last changing had taken place. Okay, and best, what is the best time, you may ask. Okay, so identify the time, bowel time before the surgery had taken place. Okay, if it was morning, then see to it that the pouch is also changed in the morning. Okay, so regular bowel movement time should be noted. So that is why nurses are very important in any care. Right, they have to ask, find out, so that you come to know that generally bowel moves anytime. Okay, and it will move more once the food is taken. Okay, so but we can train the person. Okay, and further we will see about the irrigation also. Okay, so with small pouch also they can manage. Okay, and then another time is before meals, because once they eat, what will happen? Fresh stool will come. Okay, so that is also a good time. Next slide, ma'am. So this also I told, okay, once it is 1/3 full, it should be changed. Okay, for different purpose, the stoma bag may be applied. Okay, it can be for urine also or stool. Okay, so for different procedures, whatever is there, one has to remember and told so to the relatives. Uh, Yes. Second point is when a patient is emptying the pouch in the toilet. Okay, so they can put paper on the toilet. Okay, so that when once it is emptied, there won't be splash of the water or stool on him. Okay, so that should be remembered. Okay, and position we have discussed before also, that the patient, whatever position he is comfortable with, whether sitting or uh, standing, he can take. Next slide. One can empty pouch between legs also. Okay, inside position also. Okay, when it is in the case of European commode, right? Then after once the pouch is removed, emptied, it should be rinsed nicely. Okay, and after rinsing, empty the rinsing solution into the toilet. 2-3 times they can rinse, so that the pouch becomes good, clean, nicely clean. Okay, then while reapplying, they can spray non-sticking cooking oil. Okay, and then apply. Okay, they may have to keep two pouch ready. Okay, generally there are two types of pouch. One is which can be worn for longer period of time, and another one is disposable type. Okay, so disposable type also, at least it should be changed in 2-3 days. Otherwise, then the leaking will start taking place. Okay, so purpose of spraying non-sticking oil is to prevent sticking of the stool to the inside of the pouch. Next slide. How to reduce odor. Okay, so first comes about the diet. Okay, so instruct patient not to take gas forming diet, and some of the diet gives rise to pungent smell of gas. Okay, right, like onion, fish, garlic. Okay, broccoli and cabbage also give rise to a lot of gas. Okay, so this will reduce amount of gas also and odor also. Mint coriander will reduce smell, so you can encourage them to take such additions, in their diet. Each time after emptying pouch, carefully clean the opening of the pouch is also very important. Okay, on both the sides, inside as well as outside. Okay, there are a lot of videos also available. You can watch them. I have given one such video link in my reference in this PPT also, so that also you can watch. And plus there are videos available with Pallium also, which can be shared with you. Okay, then there are specialized ostomy deodorants also available. Okay, otherwise charcoal powder can be uh, put in the pouch. Okay, sterilized one. Rinse pouch 1 to 2 times daily after emptying it. Okay? And do not add any kind of aspirin to the pouch, because aspirin may prevent odor. You see, but it can cause ulceration to the stomach. Okay, so it should not be used. Next slide, ma'am. For ileostomy, one piece drainable pouch is available. Okay, so that can be changed 1 to 3 days based on the need. For two-piece drainable pouch, base plate should be changed twice or thrice a week as per the need, because slowly the gum will go off, okay, and the plate will come off. Okay, the wafer plate will come off. Okay, and the pouch should be changed every 1 to 3 days. It will depend how frequently the patient is getting the stools. For colostomy, one piece pouch, it should be changed every 1 to 3. Uh, it will require per day also, and then it should be the pouch itself should be changed in 2 to 3 days. Next slide, ma'am. So how to manage diarrhea? So first we have to identify the cause why the diarrhea has taken place. Okay, whether any diet changes are there, or whether the patient is having lot of stress. Okay, or he has some medications which are which can cause diarrhea. Okay, so identify the cause and then remove it. Assess the characteristics of stool. Okay, differentiate between diarrhea from the loose stools. Okay, one should be very clear about it. Liquid diet can also cause, okay, if the patient is continuously taking liquids only, then liquid diet only will come. Where the patient is having too many uh, fruit juices or milk or raw fruits, okay, so they can also cause loose stools. And such things, as the patient will get adjusted to the food, it will resolve on its own also. Stress reduction techniques should be taught to the patient. Okay? Frequent and small diet should be given to the patient. Okay? Low fiber and high protein diet consisting of bland foods. They are very easy to digest and cause less GI problems. Okay? So such should be encouraged. Infective diarrhea will require medical management. Okay, so see to it that they are treated properly. Stoma patients tend to lose more electrolytes also. Okay, because the now the bowel is non-functioning. Okay, and the important function of the bowel was to absorb the liquids and electrolytes, right, and water. So there will be depletion of these things. Okay, so see to it that patient is well hydrated, okay, and he receives a good amount of electrolytes also. uh, any dairy products, spicy foods and all can cause gas also, and odor also. Okay, so they should be avoided. Next slide, ma'am. High fiber diet can increase size of the stool and it can block bowel. Okay, so see to it that amount of fiber is also adequate only. It is generally because of inadequate water intake also. Okay, so ask the patient to take 2 to 3 liters of water daily, so it becomes less cumbersome. Then corn, nuts, cabbage, okay, they also cause hardening of the stool. Inactive stoma for 4 to 6 hours with abdominal cramps will require medical attention. Okay, so all the instructions should be explained to the patient. It should be given in writing also. Okay, and if the patient is not literate, then there may be pictorial instructions also. Okay, what about everyday life with colostomy? What next slide? If the patient is young, he may like to play games also, right? So avoid any contact games like football or like cricket, basketball. Okay, where there is hard contacts. Okay, even kabaddi, boxing, they should be avoided. Okay, too much stress on the abdominal wall can cause problems. Okay, the back can come off Okay, so that can cause leaking and the situation will become quite embarrassing. Okay, so this should be C. Then traveling. So there is no such restriction on traveling. They can travel. Okay. Only thing is that they have to protect stomach with a kind of bag, okay, or purse. Okay, and always take extra collecting bag when they are going for long journey. Clothing also is generally there is no restriction, but too tight clothes should be avoided, especially around the stomach and back side. Sexual life is also no restriction, but advice should be given. Support may be required, encouragement, counseling may be required. Okay, there should not be any direct pressure over the site. That is remember. Next slide. When to call for help, when patient will approach you. Okay? There may be frequent leaking, the color of stomach has changed, size has changed. Okay? It is causing lot of problems, discomfort. Okay? There are skin rashes, okay? Any rawness of the area appears. Patient has gained weight or lost direct drastic amount of weight. Okay, so that can be reported immediately. Color also should be watched. Severe cramps, okay, they should be reported. Next slide. Severe watery discharge from the stomach for more than 6 hours should be reported immediately. If there is no output from the colostomy for 3 days, then it should be reported. Excessive bleeding is taking place. There is any swelling more than half inch or large, that should be reported. Stoma has pulled inward or come outward, that should be reported. Severe skin irritation or ulcers, if they are noticed, okay, then it should be reported. Any bulging of abdomen, okay, such thing should be noted. Sometimes there may be herniation on the inner part of the incision. Okay, so that also can be seen and corrected by the experts. What kind of complications that can take place? Next slide, ma'am. Excessive bleeding can take place, surgical wound infection can take place, incisional hernia, as I just said. Okay, so it can also take place. Thrombophlebitis, so because it can occur in any large incision on the abdomen. So here also it can take place. Narrowing of opening, that is of the stoma. Okay? Patient can develop pneumonia, right? Pulmonary embolism. Patient can get different reactions to the medication. Right? Patient may have breathing problems. Uh, Obstruction has occurred. Okay, so all this should be noted and referred to the doctor. Next slide. Here we will discuss about the colostomy irrigation. Okay, so what are the different solutions that are used? So next slide, ma'am. In the picture, you can see the different devices for the irrigation. Okay, you can see the bag. Okay, then the connecting tube. Okay, then there is regulator, then there is cone that can be fixed into the stoma, okay, and the irrigation bag. Okay, so that you can see in the picture. Okay, what kind of solutions can be used? So plain water or normal saline or soap water if wants to give enema, these things can be used. Next slide. So generally, after the healing has taken place, that is after 3 months of surgery, irrigation is started. Why to irrigate? Because uh, and it should take place at the regular stool time, okay? Bowel movement time. Certain instructions also should be taken into consideration, like when the patient is having any kind of diarrhea, not to irrigate. Okay? Ileostomy is never irrigated. uh, the cone that is to be inserted into the stoma should be lubricated well, okay, with the lubricant jelly. Okay. Use how much irrigation solution should be used. So 1 to 1.5 liter of irrigating solution can be used. Okay. And the irrigation should not be more than once a day. So as I said, it should be at the bowel time. Okay. If the patient's bowel time was in the morning, it should be irrigated in the morning. Okay. So that for rest of the day, the amount of stool that will be collected into bag will be very small. Okay. And patient can move about without any kind of problems. That is the main purpose of irrigation. Next slide, ma'am. So not to force to when you are inserting the funnel into the stoma, it should not be forced inside. Okay, so that is why one will come to know whether any kind of stenosis has taken place or not in the stoma. Then one when the irrigation set is prepared, just like how we do in enema. Okay, see to it that there are no bubbles. Okay, otherwise you are introducing air into the patient's bowel, and it will cause bulging also, and it will cause irritation also, gas also. Okay, so when we are preparing the set, okay, see to it that you run the fluid and then all the air is removed from the tubings. Okay, then lubricate it and then insert the funnel or the cone into the stoma, and slowly with the help of the regulator allow the fluid to go into the colon. Okay. Then one has to wait for around 30 to 45 minutes, okay, for the return flow. Okay, after that much time, what will happen? Now you can remove the once the fluid is inside, you have to remove the cone, okay, and clean it. Okay, then patient has to wait for 30 to 40 minutes, okay, and then the return flow will come. Okay, and return flow with the help of the irrigating bag, it will directly go into the toilet seat. Okay, so here also patient can either sit or stand. Okay, generally patients are uh, comfortable in the sitting position, and the irrigating bag is kept between the legs. How at what height it should be hung? Okay, so generally it is the bag is hanged at around 2 feet height, okay, from the stoma. Generally habit is created in 21 days. Anything that has to be formed a habit, it will take 21 days. Okay, then the normal patient will pass the stool, or you can say large amount of stool will come once in a day only. Every day he has to irrigate at fixed time. Next slide, ma'am. So here all the steps are given in one slide. You can go through. Okay, first emptying of the stoma bag. Okay, so it is cleaned. Fine. Then you can see here, make sure that replacement pouch is ready. Okay, then cutting. Okay, then next is applying, okay, cleaning and applying new bag, okay, and throw off the old bag into the bin. So the whole colostomy care is given in one picture. Next slide, we will see about the tracheostomy care. So what is tracheostomy? It is the opening into the trachea. Now through which the patient will be breathing, right? So with the tracheostomy, there will be certain changes will take place, not only anatomical changes but also physiological changes. Okay, and based on those changes, patients will face certain problems also. Okay, like the first foremost function of the whole respiratory passage is to keep it lubricated, right? So now what will happen? It will become dry very easily, plus secretions will become very thick also. Okay, there is also risk for infection. Then along with it, patient may find it difficult to communicate. Okay, then patient might lose smell and taste also, right? Because that also is interrelated, right? So based on this, patient will complain like of cough, a lot of secretions, thick secretions are coming, or patient is not able to remove secretions. Okay, they have all dried up. He is not able to communicate. The patient is finding eating and nutrition difficult. Okay, and of course he cannot hide it. Okay, so body image is also problem. So, routine care here also patient has to use mirror. Next slide, ma'am. Next slide. How to do tube cleaning. Okay, so see to it when there are two tubes, inner and outer. Only inner tube is removed and it should be cleaned under running water. Okay, then it should be boiled and reinserted. Okay, they should be clearly told not to remove the outer tube. Okay, otherwise the whole procedure will have to be doing again. Okay, so he has to remember that. Then they have to clean the tube plates also. Okay, surrounding plate of the outer tubing. Okay, so that plate also need to be clean from upper side as well as below side. Okay, because the underside will be in the contact with the skin. Okay, so he has to clean it with normal saline uh, with the help of a gauze piece. Here also patient has to see to it that skin surrounding the stoma is taken care of. Okay, that also needs to be cleaned with the saline. Then when applying new gauze, they have to cut it, okay, put a slit and then slip it under the outer tube. Okay, they can also use Vaseline gauze. Okay, that will solve the problem of irritation. Okay, and when they are cleaning they have to watch for any kind of redness, whether any swelling has taken place, color of the surrounding skin, all these things should be noted. Next slide. See, when the patient is in the hospital, suction may be possible. Okay, and it is done generally only when the copious secretions are present. Okay, and here the time is cut short. Okay, plus the suction catheter will not be inserted more than 5 centimeter into the stomach. Okay, so it should be remembered. Okay, and time also should not be more than 5 seconds. Right? uh, Ideal way to remove secretion is that patient, to keep the secretions liquefied, they have to first of all take lot of fluids. Okay, so in that way the secretions will remain liquid. Okay, and then ask the person to cough up the secretions. Okay, so what will happen? They can keep a hanky in front of the tracheostomy opening. Okay, and the secretion can be caught into the passage. Okay, so that is quite easy. When to do? Okay, so person has to bend forward and then cough up the secretions. Okay, and especially when we will see it further also, But when the person is going to sleep, or patient is going outside, or patient is going to have some food, so before that he has to remove the secretions, so that during these activities patient will not get any problem. Now, second function of the airway was the humidification also. Okay, but as we have placed the stoma right in the trachea, what will happen? It will get dried up. Okay, so what you have to do to keep the air that is going inside humidified, you have to place a wet sterile gauze on top of the tube. Okay, filter is also available. Okay, plus it will help in preventing any foreign body slipping into the stomach. Okay, so that will also help. If required, you can give steam inhalation also. Okay, so keep the steamer in front of the opening, and then they can take the inhalation. Okay, next slide. So while what about the tie? Many times you find it has become very dirty, right? It has, the color has totally changed. So ask the patient to change the tie also. Um, you can ask them to apply dark color tie also. Okay, so it will become less uh, dirty, but it should be changed. That should be noted. Okay, and for that they have to use the mirror. Okay, so while reapplying the tie, new tie, what they have to remember, keep one finger gap between tie and the skin. Okay, so in that way the tube will not be very tightly tied with the skin. uh, in case of males, they also will shave, right? So one has to see to it that the hair don't fall into it. Okay, so keep it covered while doing such procedures. For speech, what to do? Encourage to talk by taking deep breath, then block the tube and then speak. Okay, so in that way they can speak uh, in small sentences. Okay? And of course, there are other ways also, like give them paper and pen, okay? Use activity cards, right? So that can also be done. Many require speech therapist also, so they can undergo that training. Next slide. Certain things will become, next slide, ma'am, like eating and swallowing may become difficult. Okay, so you have to see to it that thick liquids are given. Okay, rather than very thin liquids. Okay, so that will have, patient will have less problem. Small bites can be given. Okay, next slide, ma'am. And patient has to chew well. Okay, and the time should be relaxed one, not in a hurry. Okay? Patient has to sit upright, okay, so that there is less problem, less pressure over the tubing also. Okay? If necessary, deflate the tube cup. Okay, so swallowing becomes easy. uh, Sleeping in reclined position may help. Okay, because the patient may bend his neck and the uh, tube, airway is cut off, right? So that should not occur. They can use recliner chairs. Okay, or a Fowler's position can be used. Semi-Fowler's. Next slide. Again, when to call for help. Next slide. When the patient is choking or coughing while eating or drinking, okay, immediately he has to consult to the doctor. If patient suffers with fever, okay, any chest infection, that also should be reported. Patient is not able to breathe properly, then also should be reported. Food particles are found in the secretions from the tracheostomy, that should be reported immediately. Okay, large amount of watery or discolored secretions are coming from tracheostomy. That should be reported. Patient is losing weight or patient is not able to gain weight. Okay, that should be noted. Patient is getting frequent cold and chest infection. That should be noted and treated well. Next slide. What about the psychological issues of the patients who are having stoma? Okay. Uh, many a times the it will change the appearance. Okay. Plus it will give rise to malodor also. Okay. So they will feel very much disturbed and socially they may get rejected. Okay. They may feel isolated because there will be so many restrictions what to do, what not to do, okay, whether to go in public or not. Okay, all sorts of things will be there. So maintain good IPR with the patient. Okay, and uh, in the beginning you can ask close-ended questions, but later on when you are talking with the patient, ask open-ended questions. Okay, so that you find the more problems, what they are suffering with everyday life, how it is affected because of certain procedures. Okay, that is very essential. Many times, what happens when you are assessing the patients in front of relatives, their answer will be different. Okay, so see to it that you also uh, assess them without any presence of their relatives. Okay, uh, then only you will get truthful answers. So that is also important. Any such procedures when patient has to undergo preoperative counseling plays a major role. Okay, what is to be done, what they will find out, what difficulties they will have later at the later stage. That will help them a lot for developing coping mechanisms. Okay, so that is very, very important. Next slide, ma'am. Next slide. So, in palliative care setting, uh, generally ostomy is performed because of the malignant causes. Okay? So, malignant diagnosis itself will cause lot of psychological distress. Okay? So, that is why doing good counseling becomes a major thing for nurses. Next slide, ma'am. It may be life-saving surgery also. Okay, so they will require constant motivation. So that is very, very important to talk with them. How to reduce anxiety, uh, find out, uh, of course, through assessment also you can find out and see for any non-verbal signs also. Okay? So from there also you can go. So use all your communication techniques when you are dealing with these patients. Encourage their verbalization of feelings and all that. That's why I said that you have to assess them not only in the presence of the relatives but without relatives also, and provide factual information related to condition. Okay, not just uh, giving them false promises that you are going to become all right. Okay, so that is very, very essential. Be truthful to the uh, patients as well as relatives. When patient is doing self care, stay with the patient so that they get confidence in doing several procedures, say for example changing of the pouch, irrigation of the colostomy, changing of the dressing in tracheostomy. Yeah, all sorts of things you have to be present, then slowly they can do independently. This is very important for gaining confidence. Next slide. There are a lot of social issues also. and patient spouse may get affected, right? Generally we see that when the carer is taking care of the patient, he also may have to stay at home only, right? So the you can imagine if the economical condition is not good for such patients, okay? So they may suffer a lot. Coping issues will be quite major. Okay? Simple things like meal times may become very difficult. Okay? To receive relatives going out in bazaar or social functions may be very difficult for them because of various restrictions. So they may feel disgusted, self-respect is lost. Okay? Always take care of the patient with dignity. Okay? That is very important. Preserve his dignity in at any cost. Okay? So that is possible only when you have good IPR with the patient. Sexuality is hardly discussed in India. Okay, so one has to uh, take account of that also. Okay, whether patient is having any social need any social support, whether patient has to get some uh, say help of different government yojanas, all sorts of this, any schemes, okay? Because many of them they don't know how to apply for such schemes, where to go, whom to approach, what kind of forms are available, what kind of documents are needed. Okay? So if we as nurses know, then we can guide. Otherwise, we cannot guide them. Okay? Take help from the social worker wherever required, and for psychological issues, counselors are help also can be taken. Next slide. Coping enforcement, comfort of patients feelings is very important. Okay, so try to find out and foster the constructive outlets for anger. And these patients become angry very soon because of their chronic nature of their illness. Okay, the short temperedness is seen in many patients, so they may get burned out, not only the patient but caretaker also. And we as healthcare professional also, every day in and out we are seeing such patients, right? So burnout occurs at our end too, right? So feelings, outpouring of feelings is very important. Provide atmosphere of acceptance is also very important. Okay, discuss any alternative responses to the situations. Routine activities, as I said earlier, they should be assisted. Participation of patient in self-care right from the beginning is very important. Whether nurses can help to resolve their spiritual issues or not, right? You may think that okay, how to go about it. Okay, but it is not that only spiritual gurus and they only can do. If you talk with the patient and relatives, half of their burden is relieved. Okay, so many patients go away from God also, and many become over religious also, because to accept the diagnosis itself is very difficult. Okay, and when they have to live with such uh, I mean life-saving procedures, and the procedures we are which are going to change their lives later, right? So they may find it very difficult. Yes, so identify their issues, as I said earlier also, preserve their dignity. Okay? They may be very angry also at life. Okay? But if they have good talking with you, then they may find it easy. Okay? So that these spiritual issues are also very essential. Okay, and if possible, take help of their spiritual leaders if they want to hold any prayer meetings or any rituals, okay, you have to go deep into their customs and beliefs. That is also there. Don't force your customs and beliefs onto them. Okay, you have to modify. So each patient will be different, uh, and so accordingly we have to move about. Next slide, ma'am. And constant evaluation of the care that is given by you is very, very important. Okay, then only you will be able to modify your care. Okay, and uh, keep good record of each care. That is also very essential. Any crisis you face, that management, what you had, one patient facing crisis may not be same as other. Okay, so evaluate each care, each crisis thoroughly and provide care. Hygiene of the caretaker, self-care of the caretaker is also very important. Okay, understand what is the level of their understanding, their willingness, how much they want to help the patient, whether they have enough time or not to stay with the patient, to take care of the patient. Okay, these things are also very important. So the next are the list of my resource materials that, from where I have taken. And with that, I would, last slide, ma'am, next slide. With this note, I would end my uh, presentation here. I hope I was able to give my inputs properly. Thank you very much for uh, if you have any questions, you can put into chat box.
The participants, kindly ask your doubts. So I hope the session was clear. So everyone are saying thank you, ma'am.
Thank you so much.
Thank you, ma'am. Thank you for an insightful session. And dear participant, kindly ask your doubts, or else you can share your experience.
I have put the link of the video also, so you can go through. Many videos are available.
Ma'am, there is a comment. Thank you for explaining ostomy care so clearly. I really appreciate how you broke down the complex steps, making
Thank
it
you.
easier to understand.
Yeah, that is very important. And when you are taking care of it, you have to not only you do the procedure, right? Explaining is also very important to the patient and relatives because they have to stay with it for rest of their life. So it is very, very important.
Okay, ma'am. So, can we wrap it up for today?
Yes, ma'am. Thank you.
Thank you, ma'am. Thank you for the session. And kindly share the PPT. Okay, it's with me. Okay.
I have already shared.
Yeah,
Yeah,
yeah.
you can
It's with me.
same. You can. Yeah. Okay.
Thank you,
Thank
ma'am.
you so much.
So, dear participant, we can wrap it up for today and see you in the next session. Thank you.